especially personnel matters. And I really need to have this volume.
I think he's calling in right now.
I'd like to thank Councilwoman Cindy Kirk for attending. Let's start with the approval of the minutes. Give folks about a minute to take a look and let me know that. I'm sorry? Okay, can I have a motion?
So moved.
Second. Any discussion? All in favor? Opposed? Abstentions?
Yes.
Abstaining because I was not present.
Okay, all right, thank you. Election of officers.
Mr. Chairman, I'd like to propose Dr. Lee Harrison for the chairman of the board. Second.
Any discussion? All in favor?
Aye.
Opposed? Abstentions? I'd like to nominate Bill Youngblood as vice chair.
Second.
Any discussion? All in favor?
Aye.
Opposed? Abstentions?
Abstention.
Okay, thank you. So we have one public comment for agenda items. I'd like to remember all of our speakers, both now and later, that there's a limit of 3 minutes that we need to adhere to. Our first speaker is Diane Carroll on the director search.
Do I just,
Um,
from where I'm standing?
Is that podium, it's sort of, are you comfortable until we get that set up, standing there? Okay. Or you come up here, whatever you prefer.
Could she step to the table at least?
You want me to be like,
That's fine, if you're comfortable there, that's
That's a
fine.
great spot.
Hi, I'm Diane Carroll. I'm a member of the Green Party of Allegheny County. The Green Party of Allegheny County supports the hiring of a politically independent director for the Allegheny County Health Department. And we request resident input on the selection of new appointees to the Allegheny County Board of Health. Allegheny County has demonstrably some of the dirtiest air in the country, with correspondingly high levels of asthma and lung disease compared to the rest of the nation. The U.S. Steel Mon Valley Works plants have been large contributors to this toxicity that threatens our very lives. In recent history, that corporation has been issued relatively small fines and actions that have failed to rein in the toxins dumped into the atmosphere. In December 2018, an explosion at the Clairton Coke Works forced local residents to stay indoors for several weeks. We now know that accident resulted in massive pollution emissions. 10 years worth of pollution was emitted in a little over 3 months. Now we are faced with the continued expansion of fracking and petrochemical industries into our region that will further decrease the quality of breathable air and safe, clean water. As devoted environmental actors and residents of the world's former steel epicenter, we call upon the ACHD to exercise their authority as the watchdog for the health of Allegheny County residents. A politically independent director and independent-minded board members can resist and defy the fracking interests of Rich Fitzgerald, Allegheny County executive. Fitzgerald's radical denials of the health effects related to the industry presents a clear and present danger to every resident of Allegheny County. It is time that the ACHD resist the temptation of corporate growth and promise of short-term job stability at the expense of environmental health. Instead, the Green Party of Allegheny County calls upon the board to embrace independence, pursue justice, and ensure the quality of life for our residents you have the privilege to represent.
on the phone? So she hasn't called in yet? Okay. I just want to acknowledge if she was present or not. Okay, so we're gonna move to old business. Jim Kelly's gonna talk about enforcement. I'm sorry?
He's cute,
Jim, speak up as loud as possible because that's why we know it's we can move the phone over.
okay.
I just think it's at the bottom of the screen.
Mark, you're in the way.
Yeah.
Other side.
And then now.
Okay, I'm gonna give the regular bi-monthly environmental enforcement update. I do want to remind everybody that we have 5 programs in the environmental health here. It's not always about air quality. We do a lot of different things to protect public health. All right, now, I'm gonna apologize again. Show a lot of numbers, a lot of graphs, and we are working on finding a new way to represent a lot of this environmental data. Like right here is the housing complaint data. We have two years worth of data here. We compare month to month. Just keep in mind, our staff is, we're typical of most public agencies. We have more responsibility than our personnel. And so to take time to make better graphs, I do apologize for that. So I'll go through and I'll explain a lot of these trends here. Our housing complaints, as you can see, there's not really a story here. They are fairly consistent over the course of 2018 and 2019. Keep in mind, December has not been updated yet because we hold this meeting at the beginning of the month, and so we don't have that data yet for the previous month. So for complaints, there's not a big story there. Now penalties, looks like there's a large difference here, but please note that these are small numbers. And so 1 or 2 makes a big difference here. You'll see that there is a lot more, compared to 2018, we have a lot more enforcement activity, penalties going on in 2019. Keep in mind also, some of those things probably were initiated in 2019, or 2018 as well. Total complaints here, you see this is fairly consistent as well. I mean, there's month-to-month variation, but there really isn't a story to tell there. I'm sorry. This is for plumbing. One of the things that you do notice here, as the warmer months, we have more work and more activity going on, you'll see that those numbers tend to go up as well. Total NOVs, again, I'm going to remind you that because of the way we keep records, we don't have the 2018 numbers in the same form, so it's not an apples-to-apples comparison here. But the story here is you show in the summertime when you have a lot more building going on, you basically have more opportunities for violations. Food safety complaints, it's fairly consistent here. This is really unusual, but these are a large number of complaints, so there's not a lot of variation there as well. Food safety consumer alerts. Now the story here, you'll see in 2018, we had a lot more consumer alerts. And in 2019, we didn't have as many. We like to think that we got the message out, that with more stringent enforcement, that maybe it had an effect as well. And so we had fewer needs for consumer alerts. Remember, you know what consumer alert is? We notify the public basically, there was a possible risk for eating with that facility. Closures is the same way, same as well. You'll see that there is a relationship between 2018 and 2019. We have fewer closures in 2019 compared to 2018. Again, we like to attribute that to stronger enforcement. Civil penalties, that story is the same as well. More civil penalties, 2018, fewer in 2019. Stronger enforcement, we think that we got the message across. Solid waste complaints. Notice again, these are small numbers, and so solid waste complaints are usually for illegal dumping. And that's all over the place, and there doesn't tend to be any type of seasonal, temporal association with that as well. Solid waste violations, again, these are really small numbers, between 7 and 1. And so these spikes look abnormal, but they really aren't, and then they are typically the result of inspections or complaints. Water pollution complaints, a lot of times these are associated with wet weather events, and we see a lot when people complain about sewage in streams. And so a lot of times when you go back and you look at the variations here, they can usually be contributed to some type of wet weather event. Water pollution, notice the violations. If you remember previously when I explained why there were, again, these are small numbers, but there were a larger number in January and February. If you remember when I talked about that, that's that 3-year cycle of inspecting water treatment facilities that results in a lot of administration and other minor violations, and so that's where this is showing.
Does that include litigation?
No, it does not. And water pollution control, this is the last thing, the Alcosan update. If you remember that we were previously that the Alcosan, all the signatures were signed. It went to public comment period closed November 19th. There was approximately 100 comments received. A lot of them were form comments. And once these comments are resolved and a final document is put together, a federal judge has to approve this order for it to be final. Air quality complaints. So you'll see here, this is our month-to-month, 2018 versus 2019. Obviously, there's going to be some associations with certain events that happened in 2018. If you remember, we had a fire. But also, here's the thing I want to make. Yes.
Sorry, just back on the Alcosan.
On
On the Alcosan consent decree.
yes.
Is that gonna generate, does the department generate a comment response document to that we receive,
they're
or
not
no?
responsible.
That's what, yeah, I thought.
The federal government will generate a comment response
Yes.
document.
Yes. This was initiated by EPA. Is that correct? Correct. Yes. Okay. So air quality complaints. Now I'm going to reiterate what I have time and time in the past. Some people have to pay attention. There's a reason that Smell Pittsburgh is not up here. We don't receive those complaints directly. So we want people to call our number so we can respond to the complaint. We use Smell Pittsburgh complaints to determine problem areas, but we get those after the fact. So Smell Pittsburgh doesn't help us initiate enforcement. So please call this number. A lot of people think when we call Smell Pittsburgh that is lodging a direct complaint with the health department. It does not. It comes to us when data is aggravated after the fact. Our enforcement people, they do look at it and they look for problem areas and they use that data. And so if they see a problem area, they're gonna go in, they're gonna look for breakdowns, they're gonna do some inspections, they're gonna try to find what's going on in these areas. But if you have an odor complaint and you want us to react to it as fast as possible, call our number. So that's,
What's the number? I'm sorry, so.
you can't respond.
Yeah, the time for, public input is during the comment period. So we're not gonna take any questions from the audience?
We find Smell Pittsburgh is a useful application. But again, we want to make sure that you're calling us if you want us to do something about these complaints. Because when we get these calls, we send someone out in the field, we respond to every complaint.
You should, however, pay attention to that data because it's very valuable.
Okay, so I'm gonna ask people to stop the outbursts. Okay, so either to stop or to leave. Thank you.
And I'm going to reiterate what I just said. We use that data to aggregate areas with problems so we can go into those areas, focus our enforcement and inspection areas in that after the fact.
I called in and one of your representatives said that you don't pay attention to that at all.
Again, I'm gonna ask people to stop with the outbursts.
And if I could make my question heard.
Okay, sorry.
It was-
Sorry, Dr. Orlock.
No,
So,
it
I'm
was
sorry.
not- It was
I'm
not,
sorry about that.
not your fault. Do you have is the number on one of these slides, or do you have
The
the
Small
number?
Pittsburgh app?
No, for our complaint, for the ACHD complaint number.
Oh, I'm sorry. It's not on this. Okay, that's a really good idea. I need to put that number up there so people know.
Gee, you think?
And again, it's on our webpage. You know, we have a lot of people who use it, so.
Yeah, can we get somebody just,
Can you say it out loud?
can somebody look it up?
412687 ACHD.
So
You get
what was the
that?
question?
The question was the official.
The official number, so, yeah.
I see the total.
The phone number.
I'm sorry, I see. Got it, okay.
Call.
Do you have any other?
Did we get that one? 412?
412687 ACHD.
Thank you, Don. Thank you, Don. Any more questions about these complaints? Okay. And yes, we do use Smell Pittsburgh data. The problem is it doesn't allow us odor complaints. And I'm going to do this like I have many times before. An odor complaint, for us to take action, odor complaint. And this is the state rule. An inspector has to be there and 3 unrelated people have to acknowledge the odor at the same time. That's why odor complaints are difficult to enforce. That's the regulatory framework we have to work within.
Can we call them the evenings?
I'm sorry, we're not taking questions from the audience.
Okay, now I'm gonna go through this, you've seen this slide over and over again. We signed a U.S. Steel settlement agreement in June 27th, public hearing. We've been talking about the comments, the comment response. So our comment response has been almost finalized. When I say almost finalized, the final settlement agreement, we are in negotiations between us and U.S. Steel right now. There really isn't anything I can say because those are confidential and privileged discussions. And so once those negotiations are complete, we will have the final response to comments and how, especially the community trust, citizen advisory committee, and various other parts of the settlement will proceed. Fire, I do want to remind everybody, you know.
I'm sorry, Jim, I just wanted, could you go back to the whole citizen advisory committee?
Yes.
What's gonna be put before the board in terms of how that's shaping up?
That won't be put before the board, because that will be a settlement agreement because it was litigation between the health department and U.S. Steel. We had the 2018 order and subsequent penalties that were rolled into a final agreement to settle those out. All penalties were paid, it was previously shown, I don't have that slide anymore. And so all the terms of that will be a legal settlement. It won't come before the board. We will brief the board
That would be great.
in the terms of that, I think, because that's gonna be important. The citizen trust is really important. This is very progressive. We've never done this before. I think it's important to note that the money, the people affected in the area will go back to the communities in that area, as well as the citizen advisory committee gives the citizens an opportunity to be part of that, that process, talking about what's going on with activity in Mon Valley. On the fire, if you recall, we have the fire, and then we joined the citizens case represented by the National Environmental Law Center. These are confidential, privileged negotiations. There really isn't anything I could share with that, except for the June 17th electric fire. We're rolled into that. And this case is ongoing. Harsco, this is new business. And so if you recall Harsco, they are a slag operation. They receive slag from Allegheny Ludlam, which is part of ATI, and it's an open area. They dump slag in these pits, and they quench it, and then they recover the slag for useful product. What has been happening in this area, we've been getting depositions. They cover the slag, they use lime in the process. When they quench the slag, they get enough draft, and this material has been depositing in areas of the neighborhood. And so this has been an ongoing issue. So we have finally executed an order. The penalty will be $107,000. There will be very specific stipulated penalties for future. But what is most important about this, and this will be a first time in Allegheny County, will require these operations to take place in a covered facility. And so we're hoping that will eliminate any opportunity for any of the dust to leave the facility and precipitate out on the local properties. And so this is very significant. Also want to point out that this is also important because this is a slag operation being covered. This is a new technology for Allegheny County. We hope that it works, it's demonstrated, and it can be applied to covered areas as well.
How many operations like this do we have in the county?
There's a number of them. So. And again, not a lot's known about these. Harsco is very specific because we actually have violations related to deposition. But the problem with other operations is, well, we have smells and we have unknown amounts of emissions that are being emitted from these. We actually have a test project what we have going on in another metal facility that will be looking at what are the emissions coming from the slag operations. We don't know a lot about them, and so we're doing what we can to find out about those. So we're very actively pursuing. Again, within 15 months, this facility should be completed. We hope that it'll be done before then. Our program enforcement update, this is more new information. We plan on posting all of our orders starting this month sometime. And so we don't have a date for that, we'll start looking for that. And so we can start keeping track of all of our enforcement actions. And that's all I have. Does the board have any other questions?
Where's that Harsco located?
This is John.
Breckenridge area, so.
Any other questions?
Any other questions?
Thank you very much. Okay, Dr. Brink's gonna give us a surveillance update.
Can we keep the phone closer to the speaker?
I think we should, actually, I think it's a really good idea.
Yeah, can we, and if possible, I'll run as fast as I can, but we maybe just do a test, they really can't hear it over in the other room. Just trying our best. It's not, it's really low. Yeah, there is. I can. Yeah, so. So can you just do a test? Quick test count, and I'll see how that sounds.
Test. Put pressure on
I know, right? I guess I'll start slowly. I'm Lily Breckenridge, Chief Epidemiologist here. I will be presenting health data that we've accumulated since the last board meeting. First, as many of you would be aware, we had our first influenza death reported this week. So this is for the 1920
No, it's still really low. Is the phone closer?
That's what I hear,
Itself?
but
Is that on?
the podium doesn't work, we have a microphone that could,
It's not good.
That wouldn't help with the
that.
phone.
That
This
connects
one
to a
here.
wall box, but that's not, it doesn't connect to that.
Screen.
actually, why don't we have, maybe have the speakers sit?
Sit. That might.
We can make some room
Yeah.
here.
That'll probably be the best.
Yep, I go.
We already have
Good
the
call.
line, yeah, we already have the line, it's just, that phone. That should work.
Okay, all right, I'll start slowly again.
Okay.
As many of you know, we had our first flu death reported this week. It was in an older individual. You can see, oh, here we go. As of the last week of the 2019, we had over 1,200 cases reported, which is pretty much unprecedented. As you can see with the other years in comparison back to 2015. These again are laboratory confirmed flu cases, and we can see how those have accumulated during this flu season. And these are slides available on our website. It represents flu B and flu A. Flu A is in red, and you can see that that is starting to creep up as well. The early entry, go ahead.
Do we know which flu A that is?
I don't know, but I believe the circulating strain is H1N1.
H1N1.
Yeah.
We don't have subtype data for their counties, but nationally, H1N1 predominates for.
Thank you.
So we can see that flu A is creeping up, which corresponds usually with the time we actually do experience flu outbreaks, which would be, again, around the first of the year, we usually see the peak happen. So that is starting to creep into the county. Go ahead.
Go back to the one more slide
Yeah.
there. So if I'm reading this correctly, this is saying that the flu cases they're much higher earlier this year than normal. And are we expecting the peak then to be higher than normal, or is that known basically until we get, because in the other years where it's peaked at different times, the
Right.
peak has been about the same level? Do you have any idea whether the severity is?
I can't guess.
It can't be,
It's something on that there is a national program on forecasting of influenza in the last couple of years about taking these data based on historical data and then being able to say what the peak will be, when it will be, how high it will be. And our colleagues that we're working with at Carnegie Mellon, there's a national contest every year for the best predictors, and they've won for the last 3 years in a row.
Did they predict this, Don?
And their predictions are good, obviously from the closer you are to the peak, the better your predictions are. So you can't predict 6 months ahead of time.
So again, this is an unprecedented start to the flu season. We have over 5,000 cases so far reported. Last year it was 212 at this time. Hospitalizations, we've had 34. Now, most of our cases of flu, again, because this has been flu B, have been in younger individuals, although the hospitalizations have been in middle to older individuals. And again, the one death that we did have in the county was an older individual as well.
Can you hold it?
Yeah.
Is there a correlation between people that are getting flu shots versus this year versus last year?
I don't know the total number of flu vaccinations that were provided, and we are not aware, within the reporting, missingness of flu vaccination status is overwhelming. We don't know for sure. As far as asthma syndromic surveillance, we did do an analysis of asthma ED visits that occurred in December of last year. And we found that of Christmas week, when there was a strong temperature inversion and pollution levels were high, in the Clairton area, there were 4 asthma visits. Now, it's not much to hang our hats on, but it represented 6.7 of all of the visits that occurred in the county, which is 660 total. In the rest of December, there were also 4 visits from the Clairton area, again, 15025, compared to 190, and that represented 2.1% of all of the asthma ED visits in the other part of December. And that was a significant difference. We had a lot of measles last year. In the US, that was an unprecedented amount. It's the most since, I believe it was 1992. I'll show that in the slide later. Month by month, measles, again, this is all the US. This does not represent Allegheny County. I'll show you our slide in a little bit. Overall in the US, it peaked in the springtime, and we had very few cases at the end of last year. This was the greatest number of cases of measles in the US since 1992. 75% of the cases were linked to recent outbreaks in New York. The majority of cases were among people who were not vaccinated. Measles can cause serious complications. 124 of the people who got measles last year were hospitalized, and 61 had complications, including pneumonia and encephalitis. And all the measles last year were caused by wild-type measles virus. In Allegheny County, vaccination coverage is 97% for. I'm sorry? 94. No, that's in the U.S. In Allegheny County, it's 97%. And that's down slightly from 97.6%, but up from 90% in 2011. And you can see every school in the entire county, their vaccination coverage at the link down there. Again, we had measles cases that occurred last year. We had 7 cases within one household that occurred in the springtime when the U.S. measles outbreak was at its height. We also have vaping-related illnesses in Allegheny County. In the Pittsburgh Public Schools, according to a recent survey, which I'll be showing you more on in a minute, 27% of students have used a vapor product in the past 30 days. Among seniors, that was 33%. Among first-year students, that was 22%. It increases with time, with age. We have a state survey from 2017, that's the Youth Risk Behavior Survey. In the entirety of Pennsylvania, 11% had vaped in the past 30 days, and among high school seniors, that was 16%. There was a big increase overall, and there's a difference from here versus the entire state, but it is something that has been increasing. In our 2015-16 health survey, we indicated that 22% of young adults had vaped in the past 30 days. We have information out there that includes information for physicians, it includes information for the public on the status of the vaping outbreak. As of January 7th, in the entire U.S., there were 2,602 cases who were hospitalized after using a vaping product with lung injury. That included all 50 states and 2 U.S. territories. There were 57 deaths reported in 27 different states. The median age of the deceased was 51 years, and the range is 15 through 75. A 15-year-old, I believe, was just reported this week. And there are more deaths that are under investigation. This is a little bit old data, but has not been updated. This is as of December 3rd. Of the 1,782 hospitalized patients as of that date, 80% had vaped THC, 54% reported using nicotine, with 13% using only nicotine according to their interview. 12% used CBD, 40% both THC and nicotine, and 5% reported no THC, nicotine, or CBD products. Among the hospitalized, the most common brands were Dank Vapes, TKO, Smart Cart, and Rove. There was a study done by FDA and CDC showing that vitamin E acetate, which was an additive in some THC-containing vaping products, was closely associated with the lung injury. It was identified in bronchoalveolar lavage fluid samples from 48 of the 51 patients who were hospitalized who had VAL available. This is the outbreak curve with a peak in September. It overall started around June, and there is a decline. Here is when our cases onset and were admitted to the hospital. We have 20. Onset is in dark blue, and admission to a hospital is in light blue.
Do we know why the decline is? It mostly education, people becoming more aware? Do we have any sense?
Shouldn't be a composition of the products or?
Probably. There have been seizure of some products. It's possible that some of these products were bootleg, but I don't think, it's still under investigation. These are speculative evidence.
It's not as readily available now, is it, in a lot of stores?
Oh, that I don't know. We didn't really pass anything changing that here. So our numbers are updated. We had 20 cases, as I mentioned. 80% were male. The median age was 20.5, and our range was 17 to 34. 90% admitted using THC products. I mentioned the national numbers already. We're fairly on par with that. We have had no deaths here in Allegheny. Pretty much finally, I'll go over results from the Pittsburgh Public Schools Youth Risk Behavior Surveillance Survey. This was a survey that was done in late 2018. You can see from the numbers that I'll show you, it took quite a while to compile this report. Why did we do this? In conjunction with Children's Hospital. We don't know a whole lot about children's youth behavior, or children's behaviors, risky behaviors. It helps Pittsburgh Public Schools, and again, this is just Pittsburgh Public, and other agencies who are supporting them, understand how to allocate resources, and provide a baseline to follow up over time. It covers behaviors that contribute to unintentional injuries, sexual behaviors, alcohol and drug use, dietary behaviors, and physical activity. We also ask them about their social supports. Of the 4,487 surveys collected, 37 were unreadable. There were almost 4,500 entered into the final sample. It was administered in October of 2018 to grades 9 through 12 in 13 Pittsburgh Public Schools, and 91% of the kids in attendance that day took the survey. It was 46% male, 52% female, evenly dispersed through the grades, third white, about a third black, 11% multiracial, and 16% other. Overall, 28% of the students responded that they had texted or emailed while driving a car in the past 30 days. That's lower than the national rate. It's highest among white students and students that identified as an other race.
Am I reading that correctly, in saying that 18% of ninth grade respondents were driving a car and texting?
That's
Just a nice
yes.
Good one.
11%, we can only go with how they responded. 11% reported that they didn't want to go to school because they felt unsafe for the past 30 days. Black, multiracial, and other race students were more than twice as likely compared to white students to report feeling this way. Over 10% reported being physically forced to have sexual intercourse, and that's higher than the national prevalence of 7%. 15% experienced sexual violence, and that's again higher to the national and state estimates of 10%, and 13% experienced physical dating violence, that was higher to state and national estimates as well. This was something that was asked Pittsburgh Public School students. We don't have national or state comparisons on this. You will note that 63% of African American students reported that they had at least one friend or family member murdered in their lifetime, and that was much higher than any other racial group. 39% of students reported feeling sad or hopeless for 2 weeks in the past year, and that's higher than the national and state estimates of 32% and 29%. And young girls were more likely compared to young men at 47% compared to 28%. A quarter of the students reported some form of self-harm, and that's without suicidal intent in the past year. Young women were more likely to report this compared to young men. About 20% seriously considered attempting suicide in the past year, and that's a bit higher than the state and national levels. 19% had made a plan, and 15% had attempted suicide, and that's twice the national and state rate. Young women were more likely to do this compared to men, to have both seriously having considered attempting, and to have made a plan, but less gender difference was observed for actual attempts. 8% of Pittsburgh Public School students reported currently smoking cigarettes. 27% used an electronic vapor product. 43% of students who use tobacco products drank a bit. 30% reported drinking alcohol in the past 30 days, and that's similar to state and national. Females were more likely than males, and white students at 43% were more likely to have consumed alcohol in the past 30 days than black students, more than almost 3 times more likely. Since vaping is a current concern, this was in the past 30 days use of an electronic vapor product. Nationally, that's 13%. Here in our Pittsburgh Public Schools, that was 27% overall. And you can see that that's much more common among the white young men and women compared to black, multiracial, and other. Heroin is obviously a big concern here. We experienced twice the rate of having ever used heroin among our Pittsburgh Public School students than national or state rates at 4%. You can see that among students who identified as an other race than white, black, or multiracial, they were much more likely to have tried heroin. 1/3 of the students reported not seeking medical treatment when they thought they needed to in the past year, and this was more likely among young women than men. 1/4 of the students reported being limited to physical, mental, or emotional problems. 68% of students reported ever being taught how to use a condom in school, and 63% noted that they knew where to get sexual health services. Among those who were sexually active, 55% had used a condom at their last sexual encounter, and this was pretty even among all of the races. Over half of Pittsburgh Public School students reported their grades as being mostly A's during the past year. 38% report ever having been suspended, and this was more likely among young men than young women, and more likely among black students than white students. 10% of students, only 10% of students report not having someone that they can count on to be dependable when they need help. And after a lot of bad news, we're happy to report that 85% still feel excited about their future. These are the reports that we have in preparation, and you can expect some data in the March meeting, the STD report, a linked infant mortality report, opioid overdose dashboards, and an infectious disease report. Yeah, absolutely. No. I dropped a lot there.
Mic there. So there were a lot of really striking and sobering pieces of data in that youth risk behavior survey. What happens with that data after following this meeting, and how is it? I mean, it's in this presentation, but how else is it compiled and disseminated and gotten in the hands of those who are?
So this has already been presented to the Pittsburgh Public School Board, and it was presented to the administration. It is being presented to all of the principals on the school level at Pittsburgh Public Schools, and we are working with Liz Miller at Children's Hospital of Pittsburgh. She is helping to provide and coordinate mental health and physical health services at the Pittsburgh Public Schools and design intervention being designed by the administration, which they can speak to much better. This report is also up on our website in full.
Does the health department and or human services have an ongoing role with interventions and?
Not directly to Pittsburgh Public Schools, but we are using these data to help us design our interventions, when it comes to young women's sexual health, when it comes to looking at the community that's vaping, cigarette smoking, and, realizing that this is limited to Pittsburgh Public Schools. So that's, of course, the only place to which we can make these assumptions. However, we are actively working with Children's Hospital and some foundations to replicate this survey in Pittsburgh Public as well as some of the other school districts. Thank you.
One other question. Is this done periodically?
This was the very first time that the youth risk behavior surveillance survey was done in Allegheny County. But again, we do hope to replicate this. This is nationally, as you would know, every 2 years, and we will be doing it again this year if things go well at Pittsburgh Public and starting to deploy it in other schools.
Is it funded? Where does the funding?
Foundations. Yeah, and you can find a comprehensive list in the report that's available on the website.
Any other questions? Okay, thank you very much. Dr. Shapiro is going to give an update on the director search.
I wish I could tell you that we were wrapping up the search, but we, unfortunately, it's taking longer than any of us had hoped. The committee and our search firm are actively at work. We are interviewing candidates, and I so very much hope to be able to give you some good news by the time of our next meeting.
Yeah, and Dr. Shapiro's been leading it's been a huge effort to basically review candidates and come up with the best leaders in the health department. So efforts are really appreciated. Any questions? Okay. I'm sorry, let me miss it. Oh. Okay. Ron, you're up.
I just want to give you a quick update on some accomplishments for 2019, some select Bureau accomplishments in no particular order. A quick update on the Frankfurt Healthcare Allegheny and also on reaccreditation. So let's start with the Bureau reports. This body actually passed the Universal Blood Lead Level Test regulation in January of 2018. And you'll notice immediately a corresponding increase in the number of children that were tested for elevated blood lead levels. Also, the corresponding decrease in the percentage of children that tested with higher levels, higher than 5 micrograms per deciliter. So, very good trends. We hope to see those numbers continue in the right direction. That is from the Bureau of Assessment, Statistics, and Epidemiology. A couple additional accomplishments in that Bureau. Successfully mitigated 2 outbreaks of hepatitis A and measles using community outreach and vaccination campaigns. Dr. Brink just talked about the youth risk behavioral survey that was completed. We also, I think, discussed in this forum the implementation of the ESPNet system, that's electronic surveillance for public health. And that particular system joins the medical records information from UPMC and AHN to increase our ability to conduct surveillance in Allegheny County. Really an impressive system, and we hope to get much more from that in 2020. The final asthma task force report was completed, as was the community health survey, and I'll talk a little bit more about that in a subsequent slide. The Community Health Bureau, they completed the first year of the REACH grant, that's the Racial and Ethnic Approaches to Community Health. This can be termed as Live Well Allegheny 2. It's really about promoting healthy behaviors directed at the African American community, increased community connections, and we do have a very detailed presentation. We will present that to you in March. Our agenda was kind of packed this time, so we deferred that to the next meeting. But some significant accomplishments there. We also achieved accreditation in the MCH program by the Prevent Child Abuse America organization. The Office of Violence Prevention now has a county-funded program manager position, in addition to an additional $500,000 in grant funds used to reduce gun violence in Wilkinsburg, and also to support trauma response for gun violence victims generally in Allegheny County. In this summer, the WIC program actually transitioned to a debit card system, eliminating a check-based system. This caused some disruption in the program. This is a rather large operation that required all the staff to travel to Harrisburg to be trained on this system. We're now coming on the other end of that system implementation and starting to see the benefits of an improved tool for reporting and the delivery of benefits for the WIC participants. And you can see also here at the bottom of the slide that the WIC enrollment has increased by approximately 2,000 participants during 2019. They served 15,000 participants during the year. Additionally, our MCH program had about 4,600 visits. Dental saw 6,000 patients. And at the very bottom of the slide, you can see some of the clinical activity that we often don't display in this setting, but important clinical services: tuberculosis clinic, 1,600 skin tests during 2019. Immunization clinics, 7,800, almost 8,000 visits, and approximately 9,000 visits in the STD clinic. Good work by the community health program. Jim talked a little bit about the U.S. Steel settlement. We mentioned that several times in this forum. $2.6 million roughly in fines, community benefit trust to be established, and importantly, $200 million of improvements at the Clarendon Coke Works that will ultimately reduce emissions and improve air quality in Allegheny County. Additionally, 132 home lead investigations during the year. A paperless process was implemented in the food program, eliminating the need for the inspectors to carry printers and paper into the field. Plumbing inspections continue to increase with activity in the county. Very significant increases in plumbing inspections. Good work by the plumbing inspectors. And the Title V permit backlog in the air quality program decreased to 25% in 2019. We continue to look at increasing staff in that area to make sure we're resourced appropriately. And Jim will talk a little bit more about that in his presentation. And then lastly, the consent decree from Alcosan, using green infrastructure to reduce the combined sewer overflow issues that we have in the county here. Lots of work in different areas. Public policy, this is perhaps the bureau that has seen the most growth in the last year. Two large grants that I believe we've talked about previously. One from SAMHSA, the Substance Abuse and Mental Health Services. That is a significant grant that is associated primarily with the distribution of naloxone around the county. In 2019, there was a more targeted effort to distribute naloxone to those communities that were more at risk to witness an opioid overdose. So you can see that we distributed more than 10,000 kits of naloxone, trained 4,000 people, and educated another 5,500. In addition to the SAMHSA grant, there's also the $5 million CDC Overdose Data to Action grant. Work has begun in earnest on that program. There are 17 partner organizations. We have substantially completed contracts with a lot of those partners, and work will begin in earnest. The two focuses of that grant funding are to expand existing surveillance efforts and also to expand prevention efforts, looking at exploring new diversion programs and also launching a harm reduction campaign. And also in the Public Policy Bureau, they processed 61 appeals in 2019. Great work in that area. This is incidentally probably additional 15 FTEs in the organization, just a very large adjustment to make for Allegheny County Health Department in terms of just adding resources to address the opioid crisis. And also I would add that the decrease in overdose deaths in 2017, there were a little bit more than 700 overdose deaths. In 2018, we saw that number decrease to a little bit more than 400. And through October, early October of 2019, those figures are just below 300. So we hope these efforts will continue to address this important issue in the county, and that number stays where it is. We won't see the decrease that we saw from 17 to 18, but we are seeing a decrease so far this year. The public health laboratory run by Dr. Wadowski, who runs a very tight ship up in the CLAC campus. He has used the BioClex system to test specimens, HIV and syphilis, this year, improving the turnaround time. He also recently became a submitting site for the Association of Public Health Laboratories to get confirmatory tests for HIV 1 and 2. And he's increased his, he's changed his confirmatory panel to a 3-panel test to a 9-panel test to reduce the false positive rates that we were seeing in the services that we provide to the Allegheny County Family Court judges. Work from Dr. Wadowski. I'll just pause there for a second. Any question on any of those accomplishments?
Could someone
Yes,
offer a comment on why the cases have decreased of drug overdoses? If you look nationally, that our region has a much sharper decline than other regions. The states west of the Mississippi continue to show an increase, and other parts in the east show a flattening. And it's not just our county, but the whole region of Ohio and Pennsylvania that show a sharp decline. And I have to say, I don't think I understand what's going on. So does someone like to address, do we know actually what this is? It would be nice to say that it's all naloxone, but is that,
Yeah.
do we know that?
It's a very, very fair question, Dawn, and I think there are a number of different items that contribute to the decline in naloxone availability. I'm sure is a contributing factor, but I don't know that we can pinpoint exactly what that decrease is associated with. Otis, if you want to offer any other commentary, did you step out? But I think in my conversations with Otis, it just has been a myriad of different things: education, collaboration amongst community partners, law enforcement, and availability of naloxone. As I said, the primary initiative with the SAMHSA grant in the first year of operation, the distribution of naloxone was kind of a shotgun approach. So we made it available very, very widely in the county. In this next year, we now have better surveillance data that we get from the ME's office in the jail, and use that information to target distribution in those communities where they were more likely to see an overdose episode. So I'm sure that is a contributing factor, and perhaps not the only one.
The reason, of course, for asking is that it would be really important not only for our jurisdiction, but all other jurisdictions to have a better understanding for what the decrease is due to.
Yes. I think it will be hard to pinpoint that exactly, but
No, it would be hard.
so if we look at naloxone and we look at prevention strategies, and collaborate with our community partners, and look at harm reduction efforts and communication campaigns, we have directed significant resources on this issue and have seen the reduction. Any other questions on anything else that presented, any accomplishments? Very good question. Just a quick update on the plan for Healthier Allegheny. We completed our community health survey recently this year. I think I discussed this. In this group, we started in the summer and ended on November the 8th. We received 4,300 total survey responses, of which we were able to use about 4,000. Just by way of comparison, I think when we did this 5 years ago, those numbers were in the 1,000 range, maybe 1,500 top. So this is a significant improvement in terms of the response rates. What we do with the community survey, it helps us to build our community health assessment, and this is the timeline that we're looking at. So we completed the survey in November. We will do some data analysis in the next couple of months. We will convene focus groups. We'll share that information with the coalition. We will follow up with some focus groups, and then we will use that information from the focus groups combined with internal data that we have and the survey data to develop our community health assessment product. And following that, we will look to develop a plan for a healthier Allegheny to determine the primary focuses for the health department and the county at large for improving health over the next 5 years. So a lot of acronyms, but it's the survey that helps us with the assessment that ultimately gets incorporated into the plan for Health for Allegheny with some other information. We just selected a few survey responses to give you a flavor for it. The survey itself was approximately 30 questions, I think 27 questions and 3 demographic type questions. This was the distribution of responses by race on the left, fairly representative of the population base in Allegheny County, and then on the right, responses by age. So a couple of questions I thought would be interesting to share were 3 most important things that make your community healthy and strong: easy to get fresh and affordable foods, doctors or hospitals that are close by, parks and other green spaces. 3 most important health problems that your community needs to work on: mental health, addiction to overdose from drugs and alcohol, and obesity. Most important behaviors that our community needs to work on: drug abuse, distracted driving, poor eating habits. Three most important things your community needs to be healthy: access to affordable, to fresh foods, clean air, jobs that pay a living wage. And just a bit about reaccreditation. So I mentioned the survey, the assessment. So this is 5 years since we've gone through this process. While reaccreditation is a couple of years out, we're halfway through. We were accredited in 2017. This is a long and involved process that requires our constant focus and attention. So now is the time that we begin that process in order to be successful in 2022 and maintaining our accredited status. So our first go around with the accreditation, the Public Health Accreditation Board is looking to determine that we are a high-functioning health department. Lots of documentation was submitted to accomplish that. And on the right, you see the folks that celebrated at the, I think that was the Boyce Park Ski Lodge. Just by way of a quick illustration of comparison, I'm not going to read all of this, but again, the accreditation process initially was to ensure that we were equipped to carry out the 10 essential public health services and manage the department generally, with over 100 standards that we were evaluated against. The reaccreditation process will look to see if we've improved and become more effective at improving the overall health of the population. And we'll look at collaboration and partnership. Quality improvement is a big initiative. Health equity, involving the community and leadership from the health department. And this is our reaccreditation timeline. Again, we're about halfway through the first accreditation, so we have 2 more years to submit annual reports that are required each year as being an accredited organization. In 2022, our application period opens, and in September, we will actually file that application. And 8 weeks later, submit the documentation. Any questions about Plan for Healthier Allegheny, reaccreditation?
Who's overseeing that program directly?
We have an advisory coalition that we work with to help develop the Plan for Healthier Allegheny.
Any other questions? Okay, thank you very much. Busy. Okay, Michael Parker talking about plumbing regulation update.
Thank you, everyone. My name is Michael Parker. I'm the solicitor for the Health Department. I'm here today to give you a quick update on our work to revise Article 15, which is our regulations for plumbing and building drainage. So we began a full review of Article 15 in early 2019 after the state updated its plumbing code by adopting the 2015 IPC. The IPC is the International Plumbing Code. It's a model code developed by the International Code Council. on a 3-year basis. We've just adopted the 2015 code. The 2018 code came out, but the state has not adopted that yet, so that is not what we are updating to. We must update the state's code. So our task has been to bring our Article 15 up to the, which is based on the 2009 IPC, up to date and in conformity with the 2015 IPC. So some of these changes are necessary under the Pennsylvania Uniform Construction Code Act. And some of the conforming changes include updates to the applicable reference standards for plumbing fixtures and materials, some new regulations concerning non-potable water systems and subsurface landscape irrigation systems. Both of those are new under state law, so we will be adopting those as well. And we're also doing some changes to outdated provisions regarding the lead content of pipes and fixtures. We are not allowing high lead content pipes and fixtures now. We're applying the state and federal code that controls that. However, our code is not up to date to that, so we are bringing it up to the state and federal standards with this promulgation. We're also doing a variety of updates to the many technical provisions of Article 15, and these account for new materials, for certain demands of public services, and for changing weather patterns. In conjunction to the conforming updates, we're also doing some changes to the administrative sections. The Pennsylvania Uniform Construction Code Act does allow us to have our own administrative method of applying the code. So some of these changes are going to include clarifying language on when projects need a permit and when a plumber must perform plumbing work. Again, we're not changing the requirements here, we're just adding language to make it clear that when permits are required and when a plumber is necessary for doing plumbing work. We're also doing some clarifying language on plumbing license renewals and license photographs, making sure that plumbers have up-to-date photographs on their licenses for identification purposes. And we're also formalizing the process for approval of new plumbing materials through our plumbing advisory board. Those are a quick summary of the changes we're making. The plan going forward is we present the draft of any changes to our plumbing advisory board for guidance on whether it's a good set of changes. They approve it or not approve it for passage, then it comes here to the Board of Health for approval. If it gets past the Board of Health, the next step is for county council ratification. That process could take quite a few months going forward. We hope to start have this before the plumbing advisory board by the end of this month, and hope to get it before the Board of Health for public comment vote either March or next week.
Great, thank you. Any questions? Okay, that's a good segue for Mr. Kelly to talk about plumbing board nomination.
I'm trying to just stand here, so this should be fairly quick. The Article 15 plumbing regulations that Mr. Parker just talked about has a requirement for a plumbing board. The plumbing board has very specific requirements of who needs to be seated on that board. I'm going to ask you to approve 2 new members of this plumbing board. First one is Jim Eichenhoff, and he is one of the plumbing board requires that we have someone from the Pittsburgh Building Association on this board. He is the executive director of the Builders Association of Metropolitan Pittsburgh and the Apartment Association of Metropolitan Pittsburgh. So he is a required member, and we know we currently don't have someone in that seat. So we're asking you to approve his membership to the plumbing board.
And his CV is in the packet.
Yes, his resume is in there. He has a very distinguished resume. Brings a lot of expertise to. He's been director of government affairs and township manager for Hopewell Township. He's also elected member of the Waynesburg Borough Council, so he brings a lot of expertise to the board. Remember, the plumbing board also advises the health department on. It's made up of an excellent amount of expertise from anywhere from the schools to the unions to actual contractors to other building associations and people who work in the plumbing trade.
So, any questions?
Motion to accept.
Okay, any discussion? All in favor? Aye. Opposed? Abstentions? Okay, thank you.
The second member, sorry. Okay, sorry. The second member is Mr. David Green. We don't have any information on him. However, we are required to have a member from the city of Pittsburgh to be part of the plumbing board. David Green is the Assistant Director for the Plumbing and Licensing Board for the City of Pittsburgh. Previously, this position was held by the Director of PLI, and we didn't get much, we didn't get much participation from the city because of that. We believe with David Green being the Assistant Director for PLI for the City of Pittsburgh, that we will have the opportunity to be much more involved, because we really do need the City of Pittsburgh involved in a lot of these plumbing decisions. And so I think this is a good opportunity to improve that. And again, is required, this position is required by the Article 15 to have someone from the City of Pittsburgh receive the board.
Any questions?
How does this nomination come to us? Is that your basically?
It's initiated from the plumbing program. And then and also from the plumbing board, because they have an amazing broad variety of expertise. They will look for other people who should be part of this ilk that makes these decisions.
I think it's a good thing to get somebody from the city. They've had some issues with permits and so forth. I've got a lot of people that say it's very trying to do business in the city itself, so maybe this could help that.
We actually think this is the most crucial member, because this seat has not been filled. Even though the director for PLI was there, we weren't getting participation. The massive amount of plumbing activity, code enforcement that goes on and out and happens in the city. So having the city seated there to help make these decisions is what most important to the folks.
Okay, any other discussion? Okay, have a motion?
So moved.
Second.
Any discussion? All in favor? Aye. Opposed? Abstentions? Okay, thank you. Sarah's gonna talk about another board.
Yes, we do have 3 reappointments to the Three Rivers Wet Weather organization that occupies some space up on the Clap campus, and was started actually with seed money from the health department. So their bylaws provide that the Board of Health appoints 3 members, and these are for reappointments for 2-year terms. And the individuals are, and the first one I will say is required to be filled by a member of the Pennsylvania General Assembly. Senator Jay Kotzka has occupied that position, and we are looking to reappoint Senator Kotzka for another 2 terms. The other 2 appointments are for at-large seats, currently occupied by Michael Lamb and Patricia Schaefer. We're also required to have a municipal official, and Michael Lamb serves in that capacity. And Patricia Schaefer is a long-standing, significant contributor to the board, and I would also request that she be reappointed to the board of the Three Rivers Wet Weather Organization.
Any discussion?
Are you looking for us to approve all 3 at once?
Yes.
Motion to approve all 3?
Second.
Any additional discussion? All in favor? Aye. Opposed? Abstentions? Okay. So air quality program update.
Yeah, it's gonna be a while. Thank you.
Where in Allegheny County is that?
It's the county chalet.
You have a lot of data I'm going to go through here, a lot of acronyms. So at any point, I please ask the board to interrupt if you need any clarification or questions answered. I'm going to give an air quality update. What I'm going to talk about trends in the non-attainment criteria pollutants. And for those of you who aren't aware, EPA sets health-based standards for 6 criteria pollutants. In Allegheny County, we have non-attainment issues for 3 of these: ozone, SO2, and PM2.5. And keep in mind that PM2.5 in Allegheny County is among the worst in the country. And so the graph that you have seen in the past are a little bit different than this. You're used to seeing those graphs with a general downward trend. So what we're showing here for ozone is the last 3 years of data. Now, ozone is unique for the standard. It's to show attainment. It's going to be the 4th highest in an individual monitor, averaged over 3 years. Those are average over of that certain value for